Hey guys, welcome to my front yard. So I'm actually coming on here really quickly because I wanted to talk to you about something that took place a couple of weeks ago that we just found out about early this week. So I think JP had a meeting yesterday with the powers that be, and what we discovered is that a company by the name of Change Health um, has been hacked. So they've been compromised. And what that ultimately means is that one in three patient records is now has now been breached and could very well be uh, um, compromised or could be made public. Uh, so one of the reasons I'm doing this on trees instead of myself is because um, when I'm on camera, I tend to get a little bit distracted. All right, so what does this mean for you guys, and how can I explain this? I am not a reactionary person. I am also not a machine. But Change Health is a company that uses a certain type of software program to act as a liaison between um, providers, which is a doctor's office or a clinic. So they act as the liaison between your doctor or the hospital where you're treated and your insurance provider. So, in case you are not familiar with the way the world works, which I'm discovering a lot of you are not, um, the when you go to the doctor, um, you have insurance typically, and the insurance then will pay the doctor for treating you. If you don't have insurance, then sometimes you pay cash. And if you don't have insurance, then sometimes you're on Medicare, right? So, and then there is some sort of Medicare-based insurance that pays your doctor for treating you. Okay. So now that we have that squared away, what Change Health is a clearinghouse. So they act as the liaison between the doctor and the insurance company, and they provide the software to each doctor, and it's very specialized software to each doctor. And then those doctors will log into their software, they'll put in the program, they'll say, okay, you know, Joe Smith needed to be treated for this type of cancer, or we had to do this type of procedure on him, and he'll put in the specific code, and then that code will then reach the clearinghouse, who will then send it over to the insurance carrier, and then the insurance carrier will pay the clearinghouse, who will then take a small fee, and then the provider, the doctor, gets paid. Okay, so when that clearinghouse was breached, what it did is it breached all sorts of data of the patient, social security numbers, patient records, the history of the patients, addresses, and all that stuff. And so what we have is one of the biggest breaches in history. What we have is sort of like a 9/11 event that took place in the medical industry, because what happened 2 weeks ago to Change Health, which they're claiming was an outside cyber attack from a terrorist. Is this all starting to sound familiar to you? Is going to change the way that healthcare is provided to the citizens from this day forward. Just in the same way that the 9/11 attack changed the way that U.S. citizens operated as free citizens in this country. So one of the things that I think that they're going to go after first is the specialized industries. Some of your bigger hospitals and some of your bigger healthcare facilities are not as affected by this. There's the doctors that operate in these facilities are still getting paid. They still have enough enough money to pay themselves and to pay their operations and continue going. But the types of providers that have a very specialized field and they only have maybe a handful of patients that come through their doors that they treat. They're very specialized needs. They have a very specific type of health need that needs to be that needs to be treated. These are the facilities that will go away first, in my opinion. I'm speculating here, and I don't think I'm wrong because of another industry called One Health. One Health basically is under the umbrella of the World Health Organization, which basically says that all human or all life, whether you have 4 legs or 2 legs, all life is the same. So it'd be kind of like this. I have a very specialized, let's just do a hypothetical. I have a very specialized need because I get specific types of headaches, say, and they need special types of treatment. Well, so does that cat down the street. So I can just go to the vet and get treated, and the vet can go to the doctor and get treated. One Health is just this idea that anything with a heartbeat is going to be treated the same. And one thing that we all know, which we've all learned in the COVID experience, is that we're not all the same. Not all of us can wear a mask. Not all of us can get a vaccine. Not all of us can do social distancing, and not all of us can stand in a little square. There are just some of us that just can't do that, 6 feet apart not all of us function very well in this, but they wanted to make it so that it was universal. They wanted to incorporate this idea that we're all the same. And that's what One Health does. So I think what this breach is going to do is it's going to destroy these specialized fields. But these giant university hospitals like University of Pittsburgh Medical Center or Stanford or, Johns Hopkins, of course. And some of these larger conglomerates are going to stay afloat, government funded, and we will all be treated like a cookie cutter health issue. And I think that's what this is, the transition. This is the transition for that, in my opinion. It doesn't feel scary. 9/11 definitely had a scarier feel than this, but it's a real shakeup. And it's a real shakeup for people who understand the way these software systems work. So I imagine that the guys who do this podcast, it's called the All In Podcast. They do it every Friday, and they talk about software as a service a lot. They invest in a lot of these types of companies. I imagine they'll have something to say about this on Friday when they do their weekly roundup. I imagine Mike Benz might dip his little toe into this because he is an expert on cybersecurity, and this is absolutely a cybersecurity breach. And I imagine Scott Adams might make some kind of little quip about this, but we're seeing it from a different perspective because we're actually watching the conversations that you're not privy to because we're in the industry. So what I'm here to tell you is that this breach in Change Health, who is the clearinghouse, which acts as the liaison between your provider and the insurance company, this breach will now alter and affect the way healthcare is provided to the nation at large, number one. Number two is that 1 in every 3 patients' data has been breached. And number 3, as much as you hate the doctors and as much as you hate the people that promoted all the bad stuff over the last 4 years, the fact is for 2 weeks, almost every doctor in this country has not been able to get paid. They haven't been able to log into their specialized software in order to file the claims when they treat you, in order to file the claims with the insurance companies so that they can get paid. They haven't even been able to get into their system. They're completely locked out, which tells me that it's the equivalent of like a bomb going off. In some of the meetings that JP was in, where he listened to these, people talk about what happened in this major breach, they were using terms like this is the equivalent of a nuclear attack. This is huge. Hundreds of thousands of facilities, like pretty much every facility in the country, except for maybe the huge ones, like the huge ones who have the money to keep themselves afloat. But just about every facility in the country has not been able to log into their specialized software system and see if any of those claims have been made, if any of those claims that they have made with insurance companies have even been paid. They're not getting their paychecks, in other words. So I wanted to just show you my pretty trees here and talk about that. If I were to walk straight up this sidewalk, I would hit the Gulf of Mexico in about 15 minutes. And then if I were to whip around and walk straight up that sidewalk, I would hit the Back Bay. It's the bay of the Biloxi Back Bay. So I'm literally 3/4 surrounded by water, just like I was in San Francisco. But this time I'm on the Gulf of Mexico and not the West Coast. So I wanted to say that to you. JP and I are going to go live on Friday and have a more detailed conversation about this and what this means with a more comprehensive explanation. And what we'll do is we'll synthesize some of the data and we'll synthesize some of the information to help you understand what's going on. But the thing that I want to implore with all of you is to please get educated about the way the world works. This is something that I wrote about yesterday on my blog piece. And it's very frustrating that so many people in the United States have no clue about what just happened regarding Change Health, and they have no clue in general about how the world works and how how it all works. You should know things. You should know these things. So I'm not going to lecture you on what you don't know. Instead, what we'll do is we will create a platform so that it will help you understand. Okay, we'll talk to you later. Thanks for listening. Bye.